Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the colon or in the rectum, which are the parts of your large intestine. It usually starts as a non-cancerous growth in form of a lump, which can eventually develop into cancer if not detected and treated early. Like in this picture, cancer is detected. When it is detected early, you can use surgery to cut out those places that is affected by that growth and stitch back the gut together. And in some cases, chemotherapy is also done to burn out hidden cells. Then the next one is causes and risk factors. What are your risk factors? Age. Colon cancer is more common in older adults, which is majority of the cases occurs after the age of 50. Then family history. Individual with history of colon cancer or polyps are at higher risk. There are some inherited factors that can contribute to you coming down with colon cancer. One of them is Lynch syndrome and familial adenomatous polyposis, that is FAP. These are conditions that when you have them, it develops your risk of having colon cancer. Then the next one is lifestyle factors. When you eat poor diet that are high in red and processed meat, you don't eat food that contains fibers, you smoke, you stay down in one place for too long while working or always at home, obesity and heavy alcohol consumption can put you at risk. What are the signs and symptoms you experience? You can experience changes in bowel habits, you have persistent diarrhea, most times constipation or changes in your stool consistencies, such as narrow stool. All these things can be a warning sign that the gut is actually suffering. The next one is blood in the stool. Rectal bleeding or blood in the stool which may appear bright or dark. Any of these color in your stool indicates there is blood in the stool, and that is something that is excavating the intestine. If not treated, can lead to anemia. The next one is abdominal discomfort. You have persistent abdominal discomfort, cramps, gas, or pain that doesn't go away. You are always weak, unexplained weakness, fatigue, or tiredness, often accompanied by anemia due to the loss of blood in your stool. All these things are those signs you will be seeing. The next one is unexplained weight loss. You have significant and unexplained weight loss without changes in your diet or exercise habits. You have incomplete evacuation, feeling of incomplete bowel evacuation after the movement. So all these things, if you feel them, you are at risk. The next one is iron deficiency anemia. You are having low blood cells, chronic blood loss without knowing the actual cause that results in fatigue and shortness of breath. This can be a sign. You have abdominal lump or mass, a palpable mass or lump in the stomach. When you palpate your belly, you see lump, is a sign. Then the next one is nausea and vomiting. You have persistent nausea, vomiting, a loss of appetite, especially in the advanced stages. There is intestinal obstruction most times where there is partial or complete blockage of the colon. These are all the signs that I have mentioned are the warning signs you shouldn't ignore that signifies colon cancer is on the way. This colon cancer, if it is arrested early, you will be saved. If not, it can progress to terminal stage and the rest. Then the next one is screening. How can you screen and diagnose this condition? We have a procedure known as colonoscopy, a procedure that allows the doctor to examine the entire colon and the rectum for any abnormal growth. They'll have to pass a camera in form of tube into the gut through the anus to know whether there is lump in the intestine. So once they find a lump, they will use a biopsy needle to extract part of those lump and go for test to know whether those tissues there, whether they are cancerous or not. So as you can see in the picture. Then the next one is fecal occult blood. You have to go for a test known as fecal occult blood, which you will be given a container to pass a stool into them. Once they put it on laboratory, if you have colon cancer, it will be detected and blood will be in the stool. Then the next one is flexible sigmoidoscopy. This is similar to colonoscopy, but they only examine the lower part of the colon. They don't go upper at the extent of reaching the small intestine, but they just monitor the lower part of the colon. The next one is visual colonoscopy, a non-invasive imaging test that uses CT scans to create detailed images of the colon and the rectum. As you can see, those places that are darker shows bowel contents. If there is cancer, it will be shown. So if colon cancer is suspected based on the following results you have gathered from the various tests, they will ask for further tests like biopsy, CT scan, MRI, and more blood tests may be performed to confirm the diagnosis and determine the stage of the cancer before they start treatment. Then the next one is treatment. The first treatment is surgery, surgical removal of the cancerous tumor and the lymph nodes that I have explained earlier. This is beneficial when this cancer is arrested early. That's why you need to go for general checkup constantly. The next one is chemotherapy. They use drugs to kill those tissues and cells. Then the next one is radiation therapy. Targeted radiation to destroy cancer cells or shrink the tumor. Targeted therapy, drugs that target specific genetic mutation and proteins in the cancer cells. All these are the treatment options for this colon cancer. You see cryotherapy, you see surgery, chemotherapy, radiotherapy, and monoclonal antibodies. All these are the beneficial treatments of colon cancer, and most of them are beneficial when arrested early. How do you prevent yourself from coming down with this condition? The first one is healthy diet. Eat a diet rich in fruits, vegetables, and whole grains, and limit consumption of red and processed meat. Then exercise, at least aim for 30 minutes exercise every day. Then the next one is maintain a healthy weight. Avoid obesity. Strive to maintain a healthy weight. If you maintain a healthy weight, most medical health concerns will not be part of your life. Obesity has a lot of bad influence to health. Then the next one is limit alcohol and avoid smoking. So all these things are the things you need to avoid. Then always go for screening. You should go for screening based on your age. If you are above the middle age, you should go for screening to ensure you don't have any underlying ailment